February is Heart Health Month, and there are some easy things that we can all do to take better care of our hearts. This afternoon, Dr. Tyler Ellington, who's a cardiologist with the Oklahoma Heart Institute, is here to discuss a few ways that we can all improve our heart health. Thanks for being here this afternoon.
Thank you for having me.
So what are some simple changes that people can make to start making their heart health a priority?
So movement is a big thing that people can do. More movement is always going to be better than less movement. And that doesn't have to look like what some people are imagining, where you're getting a gym membership and everything. I mean, it can be just dancing around the house, going for a walk around the neighborhood.
Sure.
So we recommend that healthy adults get at least 150 minutes of exercise per week to remain healthy. And then people who are working on some of their goals like weight loss or lowering their blood pressure, they might need to do a little bit more than that. But that that's something you can break it down any way you like. You can do 10 minutes 3 times a day, or 30 minutes per day, 5 days, just as long as you're getting at least 150 minutes.
Sure, getting out and moving. Diet also plays a really big role. What are some ways that we can improve our heart health through that?
So traditionally, a cardiologist would recommend a Mediterranean-style diet, and that's the diet that has really the most, it's been studied the most. It does have good results, but then we have some newer data that says maybe eating more of a plant-based diet would be a good way to go for people's heart health and lowering their cholesterol, their dietary cholesterol intake. The good news is that, sometimes you look at these diets and you say, well, I'm going to miss this food and that food. It doesn't have to be all or nothing. People who are almost plant-based get similar results to people who are strictly plant-based. So
okay.
that should be encouraging, I think.
Absolutely. Yes, no, you don't have to cut every single thing out, of course, everything in moderation, but you do want to be conscious of the choices that you're making when it comes to what you eat. Another one that you could do that's very simple, sleep. That impacts your heart health. How does that factor in? Yeah,
so healthy adults should get 7 hours of sleep per night. People who have impaired sleep, like people who snore heavily or wake up through the night, may have a condition like obstructive sleep apnea. And that's something that, if it goes untreated, could lead to lots of different effects in the heart, like even in the worst cases, congestive heart failure and atrial fibrillation.
Sure. So if somebody at home is watching, it's been a while since maybe they've been to the doctor, what would be some signs that, maybe I do need to do something more than just general practitioner? When would it be time to bring in a cardiologist?
So if there's any difficulty with getting control of the cholesterol numbers, we've got lots of different ways to help with that. Most of those are going to be with medications, but usually we recommend in people who are younger and healthier without a lot of other problems, we try to work on lifestyle changes like healthy diet and more exercise first.
Sure. Another factor would be quitting tobacco, if that is perhaps a habit that someone has. Yeah,
so smokers, are putting themselves at higher risk. Quitting smoking is one of the best things you can do for your heart. We always think about, the damage that it does on the lungs and the cancer risk, but there's a significant risk to the heart. And the good news is we consider the risk for a smoker to be about the same as a non-smoker if they've quit for at least 5 years.
Okay, very good. Thank you so much for your time and your advice and insight this afternoon.
It's my pleasure.